without further ado, I suppose the first thing I'd like to do is introduce my colleague Patricia Murray. Patricia is the senior occupational psychologist with the Health and Safety Authority, and Patricia has been working with the authority for quite a while. Like myself, we're here quite a while. We've been working in the area of occupational health for a long period, and we're now part of the new occupational health division. As you know, my name is Frank Power. I'm a ergonomist, an inspector with the authority as well. And I have also, I suppose, been with the authority for a long time. And I suppose a lot of my work is out and about in workplaces, no more than Patricia. So what we hope to do today is share our experiences. We're going to talk more around a kind of more management approach, management systems approach in terms of addressing these areas, ergonomics and psychosocial, but also look at the linkage between the two. So in terms of the presentation, I think we'll kick off with the presentations now. So thank you, Patricia, for that. So my presentation this morning is on key elements for managing ergonomic risk in the workplace. And the objectives really of the session in terms of where I'm coming from are to look at 4 key areas. First of all, to look at the human in the context of work activity involving physical effort. Then to talk a little bit briefly about the legal context that kind of relates to that, human involvement and physical work activity. And then I'll reference some relevant research that has been published in the last year and a half by the EU OSHA in Bilbao, which highlights some recommendations in terms of how we can manage and how we should be managing ergonomic risk at a workplace level. And that talks a lot about the idea of a management systems approach. So we'll briefly talk about that research. And then finally, we'll talk about the key elements for managing ergonomic risk. So we'll go through briefly, I suppose, 6 elements. We won't be going through them in detail. But just to say that there is a guidance produced by ourselves about 5 years ago, but there's a lot of very useful information in there. And a lot of the stuff we're going to talk about today in terms of the elements of managing ergonomic risk is included in that guidance, which is available on our website. And it's called the Guidance on Managing Musculoskeletal Disorders in the Workplace. Okay, so let's talk a little bit first of all about the human in the context of work activity. So as an ergonomist, and I'm very interested in how people work in different work environments. But from the context, in the context of my role in the Health and Safety Authority, I'm particularly interested in terms of the physical work activities that they're involved in. And I'm keen to highlight when I go on site to carry out inspections with my colleagues to kind of engage with the health and safety team or even the management team to highlight that we're really interested in looking at the human interaction in the context of physical work in that workplace. Now, when we talk about that, there's a range of variables that we need to consider that, relate to human interaction. First of all, the actual work activity. So what does the work activity involve from a physical context? Is it lifting loads? Is it pushing patient trolleys, handling baggage? Does it involve repetitive upper body work in the meat processing industry, working on a computer all day? So we know work is changing, but there's still a significant amount of jobs which did still involve a good element of physical work. And these photos here are examples of scenarios that we've come across. They're from case studies that we have developed, which again are available on our website. So physical work activity, the actual work that people are doing, is very much paramount. We need to know that. And that's something I would ask very quickly on an inspection, is to get more detail on the kind of work people are doing. The work environment then is a very important variable as well, a constituent, which needs to be considered. Is it very cold? People work in chilled areas, noisy. Are there issues with respect to lack of space? People having to engage in awkward postures. So some of the photos there would show, so you see an individual there in one of the photos, he's kneeling down to do some maintenance work. That's not ideal. So, we need to think how we can influence change here, and even at a design stage. So the work environment is key. So the key variables, such as the type of work carried out, the work environment, and also the materials and equipment used. So what kind of materials are people handling? What kind of equipment are they using? Do they have any kind of equipment to help them in moving loads or handling loads? We have to think of the individual. But all those factors, all those variables are determined by different stakeholders, you know, and will require input of stakeholders to effect positive change where needed. So just to illustrate that one, you know, just to give an example from our own context in the construction sector, you know, stone cladding on a construction site. So, okay, it's a work activity on a construction site that, you know, we observed, my colleague inspector and I observed. And from our context, in terms of the legal aspects, we recognized that there was very high risk exposure to physical ergonomic risks, including excessive force and sustained awkward postures. So that required an intervention, and it required us to engage with the construction company and the contractors. So the work at this stage was, in this case, was stopped, and we asked the employer. We told the employer that they needed to look at a better solution to address the risk exposure. So the employer engaged a project team to address the issue, and an engineering system was developed to avoid the lifting of cladding. So there's lots of variables there. There's the actual materials, i.e. the cladding, the work environment. They were lifting in a scaffolding area, which was quite a tight area. It was repetitive. They were doing it over a long duration. And again, the stakeholders, there was lots of stakeholders involved. There was the project supervisor construction stage, so the main contractor. There was the project supervisor for the design process. There was the actual subcontractor who was installing the cladding. There was the scaffold contractor, because they had to make changes to the scaffold setup so that they could use a piece of equipment. Then there's the engineers involved in certifying the use of equipment to move the loads, and the stone cladding suppliers. So there's a whole range of stakeholders there that influence, you know, the solution that we're looking for. So this was the case we were talking about. You know, there was a high risk exposure, and you know, we said no, we need to address this. So they came up with a solution. They eliminated the handling of large, heavy loads, which posed very high risk. And we knew that because these cladding units weighed, each of them weighed between 80 and 100 kilos in weight. So it was completely unacceptable. It was a very high risk of injury. So from our point of view, there was a contravention error that needed to be addressed. So that just brings me on into the legal context. We talked about the variables, but then we talked about the legal context. You know, I'm not going to be going through all the legislation that relates to ergonomics, but we know that we have the manual handling of loads regulations. We have the display screen equipment regulations, which are currently being reviewed and updated at a European level, and we are giving input to that. And then we have the hierarchy of principles of prevention in the Act. Okay, and we have duties of employers in the Act as well relating to safe systems of work, you know, safe place of work. But if you look at all those pieces of legislation, I've said this before, there's a lot of emphasis on risk management, avoidance of risk, adapting work to the individual, preventing risk to health at work, evaluating unavoidable risk, using appropriate means to avoid or reduce risk. So it's all around this kind of idea of a high-level management approach. And even the principles of prevention talk about that hierarchy of avoiding and reducing risk. But to do that, we need to consider, you know, the concept of a management system. You know, the idea maybe of a specific management system looking at ergonomic risk management. So if we look at the definition of management system from the International Standards Organization, it talks about a management system is the way in which an organization manages the interrelated parts of its business in order to achieve its objectives. So interrelated parts is a key part of that definition. So if we look at ergonomics in a legal context, ergonomic risks need to be managed. And all the variables stroke interrelated parts, including the type of work carried out, the work environment, the stakeholders involved, which we discussed, they all need to be managed in order to work towards the prevention and management of musculoskeletal injury and ill health. So it's a more holistic, you know, approach. It's a systems approach, and this is, I think, something that has been highlighted at a European level. Because that relevant research I spoke about was a report called Work-Related Musculoskeletal Disorders, Prevalence, Costs and Demographics in the EU, published in 2021. What they recommended were a number of things. They recommended that in order to address MSDs in an effective way across the European Union, we had to have systematic planning and implementation of policy initiatives to ensure, you know, and include a formal impact evaluation of any interventions. So we need to have some sort of a policy whether that policy is incorporated into a safety statement or whatever, or a health and safety management system. Some companies might have that, but we need to think about a policy approach. A statement of intent. There needs to be a focus on risk assessment, and a focus on risk assessment and prevention activities in the workplace through also sharing good practice examples in order to promote the concept of risk assessment and what it really means. The range of prevention activities should be broadened to focus not just on actual work at this point in time, but also work design and ergonomics as a means of removing risk at source. So that example I showed you in the construction sector, the question should be asked really, should that not have been addressed at the design stage to look at a solution at that point? Because it would be foreseeable that if you're going to install cladding units manually like that, there's going to be risk exposure. So the idea of job design and design. So I think, we as an organization need to do more around that as well in terms of maybe looking at more guidance in that area. Also, very importantly, it goes without saying that workers should be involved in risk assessment and prevention activities, because otherwise they won't be effective, and they won't be objective. They won't get all the information, the relevant information, because the people who are actually doing the job, they have certain things that they'll be able to share in terms of what kind of challenges they face. So that research is very relevant, and that kind of points us to something, something around the idea of a management system. And this is something we thought about within the authority, when we produced the guidance on managing ergonomic risk to prevent musculoskeletal injury. And we produced this guidance we introduced this concept of a management system with 6 elements. And we're not saying it's exhaustive, that's an exhaustive list. You could have other elements, but this is kind of, I suppose, a high level idea of what we're talking about. We're talking about policy on prevention and management of MSDs, or you could call it the ergonomic risk management policy. We're talking about an element like risk assessment, safe systems of work. We're talking about training. We're talking about accident and near-miss reporting and investigation, and also looking at maybe new forms of KPIs, key performance indicators. We're talking about injury management as well, even though I suppose technically it's not a remit of the Health and Safety Authority, but it is something, and I'll talk about it in a little bit more detail in a few minutes. It is something that needs to be considered. If someone is off work, how do we manage that and ensure that there's contact with them to maybe manage their return to work? And another thing I think is very important, particularly if you're talking about a management system approach, is the concept of internal auditing, or auditing in all aspects, even as part of the risk assessment process. So there are the elements. So I'm just going to speak on those key elements for a couple of minutes. So the first element really is ergonomic risk management policy, or management of MSD policy, musculoskeletal disorders policy. So what should this have? It should have a statement of intent on how an organization is going to meet regulatory requirements in order to mitigate ergonomic risk exposure. And in that guidance we published, we give examples of what that looks like. So typically, not all organizations may have, ergonomic issues or ergonomic risk exposures, but those that do should be really looking at this idea of a policy in their safety statement, so that we can see as inspectors when we come on site that they're taking it seriously and they recognize that health risks are something that needs to be managed just like anything else. And it should have a policy in there on how they're going to, their statement of intent of how they're going to meet the requirements. It can also outline the main activities that take place in the workplace, with examples of areas where activity will involve lifting or repetitive upper body work and which may need to be assessed. So it can outline also the risk assessment process that will be used. It may reference training needs for those who will carry out risk assessments. It may also reference the examples of, evidence-based risk assessment tools that could be used to help quantify the risk exposures as part of the risk assessment model. It could also outline, this policy could also outline how any measures to mitigate risk will be implemented. And, and this reference really the idea of method statements or standard operating procedures or risk assessment method statements that are clear and gives a clear indication of how the measures of interventions are going to mitigate risk and how they are used. But also, more importantly, that training is provided in those new SOPs or method statements. It can also outline the importance of the consultation process and how that will work and how that will take place during risk assessment to be effective. And also, it gives some outline in terms of recognizing that things evolve. We know that workplaces are changing, work activities are changing, the way we work is changing. So we need to be conscious of that and take that into account. And that's why we need to constantly monitoring and reviewing our risk assessment process, our policies, to make sure that they're continuously relevant and where needed, they're updated. So that's the policy aspect. Okay, so in our experience in the last couple of years, I've been doing a lot of work with the healthcare sector, the construction sector, manufacturing sector, and retail sector. But particularly the healthcare sector, we've engaged a lot with the hospital environments in the last 2 years, looking at manual handling risk management. And one of the things we started to ask them is to do a kind of an in-depth audit of all the functional areas or examples of functional areas within the hospital environment as a first step, as a baseline, to determine, from that maybe areas that may need to be assessed in terms of ergonomic risk or physical work. So example in healthcare would be medical records area, catering area, the laundries, maintenance work activities carried out with facilities management, the pharmacy area. So a lot of hospitals have pharmacy areas where they prepare medications for the wards, but also maybe to send out to smaller community hospitals. Radiology, stores, housekeeping, laboratories. These are just a few examples of some of the things that we've come across. If we look at the construction sector, you talk about, different types of activities, installation, so handling of stone cladding, wall capping, glazing, fire doors. So, our inspectors have been involved in, our inspectors in construction have done particular blitzes looking at ergonomic risk management in construction. And there's certain things that they will ask as part of those inspections. They'll ask about what plans are there for installation of heavy loads. They'll ask for data on load weight specification. They'll ask for risk assessment method statements. So we can see there, that it is possible to carry out an audit up front to look at the areas, the kind of activities, manufacturing, packing areas, incoming stores, maintenance, production. And then retail, you have order picking operations, distribution centers, but then you have your own shop there, the activities go on there, pushing, pulling roll cages. So we need to think, what are those activities? Because that's one of the key variables, as I said, knowing what work activity goes on. And then we talk about risk assessment. And I've gone through this before in previous webinars, but I can't underline how important it is. There needs to be a commitment for management, and that needs to be in the policy as well, to recognize that these risks need to be managed just like any other risk or hazard. It needs to talk about developing competencies for those who are managing ergonomic risk so that they can understand and use appropriate risk assessment tools. There needs to be good quality manual handling or ergonomic risk assessments completed to identify potential risk exposures, and also to agree on what the innovative or the engineering solutions or organizational interventions that are going to be put in place to manage ergonomic risk. But the good quality risk assessment is important, and that needs to be underlined, because your risk assessment is only as good as what information you put into it and what kind of data you collect and what kind of I suppose technical information you collect, what video you may observe, you may take photos, you may video it, you may look at. You have to actually be there. You have to look at the work environment, and you need to talk to the people, of course. And all that information needs to feed into the risk assessment methodology. And if you're using a particular risk assessment tool, it needs to feed in there so that you can be confident and stand over your results. Communication and consultation, as I said, and providing relevant training in the use of any new equipment or methods used to mitigate risk. So this is just a simple example as I've shown before, but it gets the point across. Risk exposure. This is a work activity in a workplace. It's a case study that we did. There was risk exposure here. They were handling large loads. There was awkward posture, twisting posture. The company did an analysis. They did a risk assessment analysis using the MAC tool, and they identified high risk exposures in terms of hand distance from the lower back. The actual load weight and frequency was a purple, which is a very high risk of injury because of the weight that was involved. There was issues with grip on load, high risk with grip on load and trunk twisting. So it was foreseeable from a regulatory point of view that this work activity involves significant risk. So what they did was they came up with a solution to engineer out this problem. And again, this required support, needed the support of different stakeholders to get the effective change that they put in place. So it was a kind of a management systems approach involving a number of different parties. Then we talked about training. Now, everybody's familiar with manual handling training. We developed a framework with QQI on VTAC, it was called, as it was called then, on developing standards for instructor training, and in companies then that deliver the instructor training have to be accredited with QQI. So we went through that process. It's not a perfect system, but it's certainly recognized, and it is important. However, we need to know that training is part of a risk management strategy, but training alone cannot address risk exposure. And we know that by looking at the hierarchy of control, of avoidance, reduction of risk, risk assessment. We know that, for example, the examples we just showed you there in manufacturing and construction, that training there would not solve the issues. There would be inherent risk exposures. So training is most effective when it's supported by a risk management system that provides for risk assessment and introduction of control measures to mitigate risk. And this is even more important in the area of people handling in a hospital or nursing home environment, that training has a big part to play there, particularly in the use of equipment like hoists, banana boards, slide sheets, and all the range of different equipment that's used to support the staff, but to make sure that they're not put at risk of injury, and also to, more importantly as well, that the patient is not put at risk of injury. So when we talk then about training, we're talking about the training. You might talk about training how to lift a load, which is some basic training, but also training in the use of a piece of equipment. So for example, in that the cladding example, a new system work was developed. The company came back with a risk assessment method statement with step-by-step written instruction with photos of each stage of the installation process, and that then was used to provide instruction and training to the operatives, so that they were effective in putting the parts in without damaging their backs. So briefly then, the element 4 is around accident and near miss reporting. So this is not just related to manual handling injury, back injuries, and that musculoskeletal injuries. It applies everywhere. But efforts to manage accidents that result in musculoskeletal injury should be effective in preventing reoccurrence. So the root cause analysis is important here, and there needs to be timely investigation. And the root cause analysis needs, again, to involve everyone. It needs to collect all the relevant information, and it needs to be robust so that every opinion is considered. But more importantly is, and even from our perspective, if we investigate or carry out inspections, we will ask about any accidents that were reported to ourselves, and we'll ask what kind of investigation happened, and we'll dig in a bit more in terms of the corrective actions. But also consideration needs to be given to the idea of developing key performance indicators, such as the number of risk exposures, because we know for a fact that the nature of musculoskeletal injury or ill health, the symptoms often result in cumulative damage to the musculoskeletal system over time. So you will have from time to time acute injury, but in some cases the damage is cumulative. So we need to be clear that the risk exposures may contribute to the cumulative damage to the back. So the idea is that the narrative of managing ergonomic risk in the workplace currently focuses a lot on accident reports, but it should also focus on risk exposures, and we can get that information through an effective risk assessment system. Injury management, I spoke about, retention, rehabilitation, and return to work. While the HSA does not have regular remit for how the management of injured employees is addressed at workplace level, you do recognise that injury management has an important role to play in reducing lost time and absence from work. We know that a study which looked at workplace return to work interventions found evidence that the duration of work disability and absenteeism was reduced through the introduction of interventions including early contact with employees who are off work, ergonomic risk assessments, and the presence of someone to coordinate the return to work program. So so it is something to consider. That the importance, organizations do this through their HR function or people in organizational development function, but it is something to kind of maybe incorporate into some sort of a management approach or policy systems. The final thing then the final element I spoke about is auditing. I spoke earlier about auditing being part of the risk assessment process, where you kind of carry out an initial audit of your organization, like for example in healthcare, to identify the functional areas that may need to be considered as part of a risk assessment process. But internal auditing needs to take place as well, where maybe audit your policy to see is it effective or does it need to be brought up to date. Audit risk assessments that have been produced to see, are they effective? Are they actually giving the information are they properly done? Audit SOPs or risk assessment method statements to ensure that they are clear and understandable. So, there's lots you can do in terms of internal auditing. And in this guide that we've produced, there is there are examples of checklists of questions that can be, incorporated into an internal audit, looking at ergonomic risk management. So that's really a kind of I suppose, a whistle-top tour of the 6 elements of managing ergonomic risk from our guidance that we've produced. So in conclusion, we've spoken about the human in the context of work activity involving physical effort. Consideration needs to be given to all variables that impact in terms of the possible risk of injury. We've spoken about the legal context, the ergonomic legislation, manual handling of loads, DSE, the Safety, Health and Welfare at Work Act, the principles of prevention, and the importance of risk management. A lot of the requirements in the legislation talk about risk management, risk avoidance. We spoke about the research that has been produced, which underlines that this risk assessment, risk management approach, or management systems approach is key. And then we've covered the 6-step system approach for working towards prevention and management of MSDs. So that's really it. This is a copy of the publication that's available on our website, Guidance on Prevention and Management of MSDs in the Workplace, which you can download from our website, for free. So thank you very much for that. So what I'm going to do now is I'm going to hand over to Patricia. So Patricia, I'll leave it with you. So thank you very much, everyone. We'll do the question and answers at the end. Thanks, Patricia.
Thank you, Frank. So everybody, I'm sure you found that stimulating, and just to let you all know that there's over 200 of you out there watching and listening and taking notes, hopefully, and hopefully also kind of enjoying the presentation that we're bringing to you today. Because we know from psychology that if you actually are enjoying something, you'll perform better at it, you'll find it less stressful, and you'll be able to then kind of produce more out of it. So a little bit of advice first. Whatever you've been listening to there in terms of Frank's presentation, a lot of my presentation is going to mirror some of what Frank said. So just take a little minute now, take the odd note of what you want to ask about Frank's presentation later, and maybe put 1 or 2 notes down of things you've really learned that you're going to do, say tomorrow or next week. Because what we tend to do, we listen, we think, great idea, that's good, and then we don't follow up. So learning theory would say, put a little note down in your own mental diary or in your real diary of what you're going to do to implement something Frank just spoke about. And I'll hopefully ask you the same thing after I've spoken. So I'm going to talk about managing psychosocial hazards at work. Again, as I said, lots of similarities, because as Frank said there, it's the human in the work system. And in Frank's case, in relation to physical, measurable and photographical hazards in the workplace, whereas what I'm going to talk about doesn't have quite that clarity around it, because most of the things are not things you can take a picture of. So we're going to talk a little bit about psychosocial hazards. What are psychosocial hazards? Because there's different names for these things, and we use the terminology of hazards, systems of work, prevention. We use hierarchy of prevention, whereas other people might use other words for this. And a lot of people would call the area I work in kind of work-related behavior, work-related stress, which is all very well. But I'm going to talk a little bit about how psychosocial hazards are dynamic over time. That's one of the things. We don't know everything about the area because it's dynamic and it's moving. There's a lot of research that I'll reference. And then we're going to talk about that in the context of health and safety organization. So some of you, I know I can see some of the names there, and I'm familiar with some of you, and some of you have not other presentations both Frank and I have done, and I've done on my own, and you're working in a HR background, or you're working in OD, or you're working in training, and that's all very well because it all fits in. But the context that we speak on is health and safety hazards, workplaces. And I want a little link on that and the connection between workplace health and workplace safety, because as an organizational psychologist, I'm not just dealing with health, I'm dealing with occupational health, and that's where I'm housed, but also the link between occupational health and safety. How do we approach psychosocial hazards? I'll give you some advice on how to approach it yourselves. If you're in a workplace and you're tasked perhaps with, your task maybe for the next 6 months is to put in place a proper system of work to do with psychosocial hazards. So I'm hoping that at the end of my presentation, you won't be at sea. That's a low bar, okay? But that secondly, not only will you not be at sea, you'll have a system that you have in your head that you think, I'm going to start with this, I'll input something in 3 months' time on this, and then finally I'll add this to it, so that by December I have something of a system. And that system then will be, I'll assess it and see, have I consulted with staff? Because as Frank said, that's very important, more so I'd say in our areas than even other areas, because in other areas where there's kind of hard science on it, you can consult with some hard science in terms of regulations and law. You need to, for these areas where people are directly interacting with systems, consult with the people. I'll talk about Work Positive, which is our HSA developed in partnership with State Claims Agency. Long-time partnership there, good partnership, synergistic, work together, looking at developing and improving and making it easy for you to do a risk assessment on psychosocial. And to do a risk assessment on psychosocial, that's easy to use, whether you've got remote or hybrid work or people who are all on site or half off site, and how you can do that for free. And you can do that without a huge amount of resources in terms of people. And you can do that with a little bit of assistance from myself and the HSA, and indeed our colleagues in the SCA and our host and Wellbeing Hub. Finally, a little bit about strategic approaches, because this area is really not a standalone area. It's an area that's embedded in all aspects of work. So some years ago, there was, as we all know, a big crisis in the world in terms of COVID, and some 10 years prior to that, there was a big crisis in the world in terms of financial crises. And the people that survived well throughout that, and the organizations that thrived well, are organizations and people and systems that were dynamic and that were able to pivot, the mot du jour I know, but that were able to slightly move and take on board some of the things that change brings about. So it's really in the area of work-related stress or psychosocial hazards, the whole area of how to be able to.
Sorry, Patricia, I think you've just muted yourself there by accident.
Am I unmuted now?
Yeah.
Oh, beg your pardon. Thank you very much for that, Sean. So some common themes with the ergonomics presentation and the ergonomic systems. Here you'll see it. So in all areas of the work we do in the HSA, and indeed in my work and Frank's work and our other colleagues' work, both within health and within safety, is policy. So policy is not divorced from the action. So psychosocial informed policy. Now you can have a policy on psychosocial specifically, or you can have psychosocial elements in all of your policies. And ideally, you'll have psychosocial informed policy, which means that you're taking on board the person and their interaction in the social environment at work. You'll also have psychosocial risk assessments, and that's to do with, as Frank alluded to earlier, if someone's doing a piece of work, then you should be assessing it for the physical hazards associated, but also some work has more than others has the psychosocial elements or risks, and I'll go into what they might be throughout my presentation. We're always aligned with, and we're always anchored by safe systems of work, because we operate under legislative imperative. So safe systems of work, think about that for everything you do. Safe systems of work does not just mean physical safety. It means overall safety, the whole person. So is this system of work safe for both physical hazards that might be there and also for psychosocial hazards that might be there? We're going to allude then to the lower line here is things that we actually suggest, that the actions, I suppose, and things that are going to be done from the above, from the policy and the risk assessment and the systems of work, and the more nebulous, philosophical, if you like, or kind of organization-wide evidence of taking this seriously, but also evidence of taking something seriously is doing things. So Work Positive is something, as I've alluded to, that helps you to do the thing. It helps you to do the risk assessment, and it helps you to put in place safety templates, health templates, and templates that would be reliable and consistent when somebody, if they do come and say there's some kind of psychosocial hazards in relation to this piece of work. I'll give you some examples of what they might be from going out to organizations. Also, anti-bullying policies. Bullying is a hazard. It's a psychosocial hazard. This is well known. It doesn't mean that every organization is going to have bullying, but where there's people, there's the potential. So it's the potential hazard. Where there are people, you should have a system of work for dealing with bullying and related things, because really in our act, it's improper conduct, and bullying fits in within that. But there can be other improper conducts that are, broadly around the area. And the three things I'd say about that are, a person can, with all bona fides, believe that they're being bullied, but in fact, they're in a conflict that they see through the prism of them being denigrated in a bullying way. And an independent assessor might not see that as being bullying, and that's valid, and it happens. Another person could be feeling they're being bullied, and in fact, they could be perceived by the other person to be the bully. So, and finally, there could be someone who knows that it's not quite bullying, but knows it's conflicting and it's causing them stress and distress, and they want some assistance with it. And all of the anti-bullying policies and process should assist with all of those things. And now we don't deal with harassment in the HSA. It's not within our brief, as you know. I'm sure the harassment piece is under 9 grounds, and that is behaviour that's equally as discriminatory or as you know, negative and undermining, but it fits in with one of the 9 grounds, which can be like sexual harassment or harassment on the basis of disability or one of the other 9 grounds. But we don't deal with that in the HSA. And then finally, huge thing, and Frank alluded to it, is training and development. I put it in and development there because in the area that I'm in, development is important too. So it's not just training, hard training, it's training and then allow the person and have a facilitative approach towards the person becoming more familiar with what you've trained them in. So these are the areas that we're going to go through in the presentation. If I can just say, where are we in Ireland right now? So the policy context for psychosocial prevention, it's always slightly moving. I was meeting my colleagues in Europe there before Christmas, and we were discussing the area of psychosocial because it doesn't specify in the Act the word and the absolute need to do this, that, and the other in terms of psychosocial. But we are in Ireland advanced in terms of, we accept that within the Act, there is a necessity of employers to prevent harm to employees. They must have a safe system of work. They must have competent management. They must have proper training. They must have systems of work that are reliable, and they must have competent supervision. So all of these things have a big impact on psychosocial, because psychosocial is about how people are in the workplace together. The rationale for why it's important in the workplace, well, I think those of you who are here today probably have already been made very aware of that, or you wouldn't be signed up for this session. First of all, there's general moral duty to treat people well. Secondly, there's all the research that says that when people feel that they're treated well and they feel that they're respected, they behave better with others, which is really important for your conflict and bullying piece, but also for your productivity and performance piece. And finally, litigation. So as you know as well, there's kind of litigation where people feel either through the labour court system or the Workplace Relations Commission, or indeed through the civil courts. But really, I'd say overall, if you're trying to, you know, if you're working for an employer, you want the workplace to be healthy and you want people to be generally satisfied, then you will not ignore psychosocial. You might say it's soft, I'm not going to do too much. And really, to do it well, you don't have to create something massively new or massively complex, or indeed you don't have to employ very expensive consultants and very, you know, kind of complex systems. You really just have to look at what you're doing, assess the risk, have a preventive policy, assess what's going on, what's the work being done, what are the people who are doing it saying, and then how can you put in place over time, by prioritizing risks, some control measures for dealing with those things, and then how do you monitor and review that? I'm going to talk a little bit on information, what you can do to reduce the risks, and there's some sample protocols for how to identify and respond to cultural psychosocial hazards within the Work Positive tool. A query I had recently from somebody just on this was looking at different cultures working together and how different cultures can bring a certain kind of cognitive bias. I know you've probably all been quite familiar with this of late, but some cultures can have a different perspective on gender issues, for instance, gender empowerment, or indeed different issues in relation to kind of what type of people they should be working with, or what type of people they're used to work with, or even they can have discriminatory views or opinions about working with other people. So you really need to know that we have to have a system where everybody is treated equally, where everybody is accepted as being a bona fide member of the work community. So when you're doing your assessment, there's no difference made for gender, for expression of that gender, or for educational background. When you do Work Positive, everybody is an employee, and you're only notified in terms of your identified is your role in that organization. So if we did a work positive, for instance, recently on a big transport national state company, and we looked at people who are either in the driver zone or they're in the admin zone, they're either there for longer than 5 years or less than 5 years. If you want to look at tenure and the influence of tenure, you might look as well at people who are in management roles and who are in non-management roles. But you don't look beyond those kind of things, and you don't identify any individual people. Also, if someone comes at stress at work, what kind of questions should you be asking, and should they be asking themselves? We'll touch on that. And so information on this is available on HSA Learning, of course, and on the HSA website. Some of you will know we've got a campaign at the moment on work-related stress. It's just an advice and assistance campaign, putting people in kind of in touch with our website and in touch with the information we've got on the website and also on HSE Learning. And then we have some courses there, very short courses, 20 minutes. Any of you who are in charge of or who are tasked with doing something for employees in a big organization, a very simple way to approach this would be get people to do our managing bullying course or to do the work-related stress course. Again, online, free, and up to date. So what does research say about psychosocial hazards? Research says, and this is valid, reliable research that's repeated over time, is consistently finding 3 main things. And these are models of research. I've put a few new ones in the end there. They're not new models, but I've just added them because they're to be considered. But the main model we've always gone with is the demand control support model. And it says that, are the demands reasonable of people on work? Are the demands reasonable? Now, obviously, there's a subjectivity to this because somebody might say the demands aren't reasonable in my view. And we say, well, what does it mean for a demand to be reasonable? And that's what work positive measures or assesses. It asks people, do you feel that the demands placed on you are reasonable? And you've got a 7-point Likert scale. And the reasonableness comes down to, are they manageable by you? Do you need some assistance in them? Are they too complex for you? Are there too many of them? Because most people will find that, and we know from our own research we did with the ESRI some time ago, that some of the causal factors for work stress are to do with the demands being too high. Now, we talked earlier about training. So is it a training issue? So what you're trying to do always is identify something you can put in place to treat the ill or the ailment that's been identified by the assessment. Control over the role and control over the job. Now, control over the job is not a standalone feature because you have more control over the job if you're trained for it. You have more control over the job if you have competence to do it. You have more control over the job if a risk assessment has been done that shows you where the vulnerabilities might lie. So for instance, if you're working with a long queue of people, say that you're a person on a desk where you've got a long queue, if you've given some information about how long the queue is, how long it's going to take to get through your queue, if you're given some information about when your break time can be in advance of taking it, then you're given some control over your place of work, which will alleviate somewhat of stress that might be there because of continually dealing with long queues. Support is very important. Peer and manager support are both measured in the tool. Peer support, a lot of people will feel when they're in a workplace that they don't need support. They don't ask for support. And so they might answer this with a negative saying, no, I don't really need support though. But what you'll find is when people hit the hard times or when there's some kind of issue that is brought to people's attention, they do need, like all of us need, some level of peer support and indeed manager support. So it's beyond management, it's support. And the research says to us that even if you've got 2 people, both equally able, both equally trained, both equally capable, and you give them a stressful task to do, and by a stressful task, I mean a task that anyone is going to find stressful. So anyone would find stressful. You have to deal with a lot of people. You have to present on something you don't really know about, and you've got to do it within a certain time frame, and you've got very little time to prepare. Most of us will find that stressful. 2 people, similar backgrounds, similar labels, but you say to one of them, I've got a good bit of support here for you. And you say the support actually is given by a person who knows a lot about presenting and who knows a lot about the content you have to present on. And you say to the other person, you've no support. Already the person who you've offered the support to is going to, in their own feeling state, feel a little bit less stressed, even if they don't access that support. So what's that about? It's about how we think and feel. And we think that how we think is independent of how we feel, but it's not. It's always influenced by how we feel. So when we're thinking out our plan for our presentation and our plan for our content, our feeling becomes less stress focused because we feel we've got some support. So very important in workplaces to have the language of support and to speak support and to then follow through with actions of support. Relationship is a huge reason why people go to work, why they stay at work, and why they like their jobs. So, you know, I've met people who are in touch with the HSA for various work-related issues, but they would say sometimes, well, I could retire if I wanted to, but I'm not, because I really like the people at work. I'd miss the relationships. And I know people, colleagues of mine in psychology who work in the area of coaching around the retirement piece, say a lot of people are finding it really difficult when they have to retire because they've really developed their main relationships through work. So relationships are a huge thing at work. And if they're very conflicting or very confrontational, or else they're not allowed much in work, then it can be a difficult and a stressor for people. Role and knowing your own role and other people's role and other people knowing your role can be a stressor. Again, when work positive, we don't find role coming up that often. We've often commented on it that it's not one of the pieces that comes up a lot in Ireland. I think we seem to be quite able for the area of a bit of role ambiguity, because that's one of the pieces that comes up in some other cultures. But we seem to not identify that so much as a stressor, but it is a known stressor internationally in the literature, not knowing what your role is or how it fits into the overall role. Now, I'll say about these changes, the last one, and it's basically how it's managed. But about these, it tends to not be one of these that causes distress for people. It tends to be a mixture, a synthesis, and they have combinatorial effects, so that you have one, you can deal with it fine. You have two, it's becoming an issue, and usually where there are three, then it seems to be overload for the individual. So what we're really looking at when we're looking at stressors or psychosocial hazards is the combination effects of different stressors. And the research says that demands, control, and support are very linked. So it's a triangle of the demands placed on me, the support I have. If I have enough support, I can meet those demands. So if my demands are increased and I have no support, or support's taken away, or some control is taken away, the person's going to feel more likely to report being stressed. And then it could be that there's a psychosocial hazard across the whole unit, if that's happened to a group of people. Another model of work-related stress or psychosocial hazard is the effort-reward imbalance model. And there's another model, the learning and growth potential, cognitive enrichment, which says that everybody needs to have a learning and growth potential within their job, or eventually they'll find it more stressful. And they need to have cognitive enrichment, which is, again, learning and being open to learning, and rather than being treated like a machine, that they're always doing the same thing. So it's usually a combination of all these things. And the context of them is work. So we do need to be cognizant of the fact here that this is not going to be everything for every person. It's not going to be what we might do in a family or in a social group of friends where we try and make everything perfect for everyone. We're in the context of work, and we in the HSA are working in the context of our ACT. So psychosocial is the interaction between the person and the environment, the whole environment. So it's not the interaction between the person and the task they're physically doing. It's more than that, but it includes that too. So it's the person, their fitness to work. The person job fit matters. So how you induct a person, how you tell them about the job. And we recently were doing a big project with one element of the workforce where they're exposed to quite a lot of difficult content, and very important how a person is inducted into that job, what training they're given before they start the job, whether they're competent, so the recruitment and selection process, and then performance management, ongoing performance management and review. So also the physical environment can be a stressor. As we know, research definitely backs up noise, intermittent noise, loud noise, light, not enough light, too much bright light, and machinery, both use of machinery, difficult to use machinery, training on machinery, or dangerous machinery. But then we're coming back to the social environment. So the psychosocial stressors involve the person in the context of work. And the social environment, big issue with peer-to-peer relations, management to managed, team to team, organization-wide, and hugely individual to client or customer. So customer-facing work, client-facing work is a known stressor. Somebody might say, it's not for me because I love dealing with the customers. I have no stress dealing with customers. I get difficult customers, but it's not stressful. That's great. We've got other people who say, I don't deal with customers at all and I don't want to, and it's not stressful for me. That's great too. But in the main, what research says is where a person has to deal with customers regularly. So they're in a customer facing role, and where that customer relations with the person is one of need. So you're always giving something of information, you're giving a service, and that could be that you're exposed to demands from customers that you can't predict. That can be, it's just a trigger. It's just a note that we say that's a potential hazard. Potential hazards don't mean the person is stressed. So we have to always, I like to make the analogy that if you're talking about a building site and you're talking about people walking through a walkway and there are heavy things stored at a height above that walkway, it doesn't mean anyone's been injured, but it means there's a potential hazard there. So you would not store heavy, dangerous machinery or items above the heads of people who are walking underneath it, because you would think that's too much of a potential. And that's what we're talking when we talk about psychosocial hazards. Doesn't mean you'll be injured, but what you try and do is have an organization that's organized so that they're not there. So again, looking at safety, very important. I remember one person saying to me back years ago, 20 maybe years ago, when we were piloting Work Positive, well, your stress at work is really down to the individual. So I don't see the employer having any role in it at all. It's all down to the individual. And I said at the time, well, safety behavior, you could say, is all down to the individual. Risk-taking behavior, you could say, and we know from research that there are certain types of individual who are more prone to taking risks. It doesn't mean it's all down to the individual and you can put your feet up, employer. It means you've got to take note of that and you've got to include that in your system of work. So here we have the relationship between psychosocial and safety, and anyone who's running a business would want to take cognizance of this, because people who are stressed are more likely to cause accidents. They're more likely to make mistakes. And any of us knows when we're rushing, when we're driving somewhere, very important, we get there on time, and that's the time we can make a mistake. We can go the wrong way, take the wrong turn. And it's just because we're stressed, our resources are not what they should be, and so we make more mistakes. So unsafe systems of work cause stress independently. So cramped conditions, unsafe storage, they have chemicals that a person's working with, and we get these complaints into the authority and requests for information on them. Sloppy practices, which result in near-miss patterns, can make a person stressed at work. Lack of machine guarding, someone has to use it, can make them stressed. So a lot of regular safety issues that obviously my colleagues monitor in their inspection process can cause distress on stress and work-related stress, and it'd be a valid complaint, absolutely validly held up, and we would have then very good ability to give enforcement action to that employer, because it's a known stressor. Stressed people are more likely to make mistakes, causing unsafe systems, and then unsafe systems are more likely to cause stress, so it's two-directional. Now, the difficulty with research in this area is because different people react differently to different stressors. It isn't one size fits all. What you have to do is think of the reasonable person when you're the employee. And that's why we have to come back to policy, training, systems, always around the system. Because you might find an outlier will fall down within that system, and then you pick that outlier up and you look at that as a vulnerable person. But you know then you can relax saying, I have this mitigation here because I have a good safe system of work for the generality of employees. Again, I referenced earlier SRI research we carried out some years ago, and we looked at what are the associations with work-related stress cases, and they're rushing, juggling, being fearful, and hiding your ability. So that's very important for new employees and for training. So often new employees hide that they don't have a competence in things. They've received the training, they didn't really gather it, but they have to hide because they don't want to be marked down in a probation period. So hiding things, being fearful generally, juggling things, too many things. It's much more resource heavy to have to juggle 3 things, and all of them might have a weight, say, of 40% than it is to have only, 2 things or 1 thing that we have to do to the kind of 120%. Because if you're just doing 1 thing, the resource you're putting in is easier to get into that 1 thing. The actual resources that we take juggling or moving from 1 thing to the other also costs us. So, and the thing is, that the problem with stress a bit is that when we get stressed, we tend to increase some of these things. We increase our rushing to get more done because we're stressed. We juggle more things because we think we better need it to catch up. And we are more fearful because our bodies are aware of the stress, and the effects of stress on our body are like the effects of fear, because stress is very aligned to fear. And then we have to hide the fact that we're stressed. So it's a big, unfortunate kind of existential element to the area of work that I'm in. How you manage psychosocial is both reactively and proactively, and your system of work. So proactively, you look at your recruitment checks and you see, have we described the job properly? Have we looked at psychosocial issues with it? Have we asked people who are doing the jobs, what are the psychosocial issues? Do we have internal fair and consistent systems that we apply to everything? We make sure people are made aware of the systems of work. We make sure people are aware of the anti-bullying policy. We make sure they're aware of the risk assessments that we have, or we have documentary evidence. Have we done Work Positive or some similar type of survey type of or assessment system for the psychosocial hazards? Reactive, some of these go into the HR space, reactive policies and procedures that HR will have, management systems, management training, development issues and abilities for people, in terms of even bringing people's own abilities up to understand stress, and then rehabilitative. As Frank said, we don't have a legal role in rehabilitative, but we certainly give advice on if somebody has given a complaint of work-related stress, and even if you find everybody else is not finding work-related stress, so there's no psychosocial hazard identified here, you're not going to ignore that person and say, well, that's your problem, so Patricia. You're going to say, what can we do to increase your ease at work, your satisfaction, and your performance? A little bit about Work Positive. I hope you'll go online there. I've got the address there and have a look at it. We're actually updating the tool right now this year, but it's not like it's inactive. We've got a lot of people. In the last, say, 2 months, we've had about, I'd say, 5,000 people taking up the survey tool, individuals, employees, because we did a good bit of a run there on some kind of state bodies and in the transport sector. We're looking at how to assess the current state. That's what we do in Work Positive. So it's what the people are perceiving right now. We can get the organisation subclassified into roles, as I said, in regions. So we've got people in one region. In fact, we've got a big organisation who got onto us recently saying they want to do it in their outfit in one of the Nordic countries, and they've used it in Ireland. Is there an issue with that? We said absolutely not. Go ahead and use it in the Nordic country, and then you'll be able to compare your site abroad with your site in Ireland. It's used in the UK, it's used across Europe as well. Now, other countries have their own system and they don't have to use ours, but we find that organisations that have maybe used ours or used the HSE's tool, which is a similar tool, and want to use it in another place that they're starting up, whether it's in Europe or Eastern Europe. It informs and sets the scene, and it assesses the potential risks. It's easy to administer, free of charge, suitable for, as I said, remote or hybrid, and it produces reports to inform your interventions. I mean, these are the controls we talk about in the Health and Safety Authority. So we talk about assessing and then putting in place controls. It's based on reliable research and it's normed in Irish organisations, and it's available there on Work Positive. We ourselves give some assistance with it. So those of you who are interested after this in talking about it or looking into it, have a look first online. You'll see stress templates there. You'll see a lot of different things you can just download from the site. But if you further from that, you want some discussion around it, no problem to email me directly and I can get back to you, or indeed my colleagues over in State Claims. So Work Positive is a risk assessment tool for psychosocial. It's not the only one. You can develop your own one. You can look at SurveyMonkey and develop some. You can look at the specific part of the organisation that you think is more exposed to psychosocial hazards. And a lot of times people start with that. So they'll pilot it on, say if it's a state agency, on the group of people who are exposed to a lot of maybe difficult clients. Start with that group and then get your results. And then a few months later, do another group. That way you're staggering your efforts in terms of interventions. Case study briefly, we either get RFIs, which is requests for information, or we get complaints in the HSA. They're classified as either one. So classify this one as a hazard of bullying, relationship breakdown. Someone makes a complaint or they make a request for information to us, and how they're differentiated if they're saying, I've made a complaint in the workplace and it's not being dealt with. It's an RFI if they say, I want some information on what the company should be doing. So in both of those cases, we look at our code of practice on workplace bullying, which is quasi-legislative because obviously, as you'll know, code of practice is written underneath legislation. And we would then ensure the employer has a proper system of work. We're always going back to the system of work. We don't have a role in determining whether or not the hazard exists. We don't do investigations of whether or not bullying occurred. That wasn't given to us. It's not within our remit. But we do ensure that the employer has a proper system. And we do give verbal and written advice to employers who aren't complying, and they will soon comply, or engage with employers to ensure that they know why they should be and how they should be complying. The employer must act reasonably, and they must record that and provide evidence. And as we said earlier, that's for a lot of reasons. One is the right thing to do. Two is the person can take litigation, and we ourselves, through our inspectorate, can take enforcement. And finally, and importantly, it will make for a better employee body, and your productivity will be up and your performance will be up. The system that follows on from our system is the WRC system. So that's the adjudication system that people can go to, following on from that to see whether there is an issue with their bullying case or not. So we then sometimes will be a little bit involved in that. And certainly our interventions would be involved, and any correspondence we've had with the employer or with the individual would be used for those cases. The ultimate test for any of you to think about now in terms of the area I've spoke about is it a safe system of work you've got? Is it health aware? Is it psychosocially informed? Or is it thinking that people are just robots? There has to be some health awareness. Occupational health is important. It's on the health and safety map, and you need to be aware of the whole person. Is it reasonable? Is your system reasonable? Is it documented? And is it consistently applied? And do you have record of actions you took? So the records of actions are if you've got work-related stress complaints, or if you've got work-related bullying complaints, or other psychosocial related complaints. Is it a safe system of work? That's what we're about in the HSA. And safe does not mean just physically safe, it means mentally safe too. So thanks for your attention. I'd like to ask you now to, again, try to write down one or two things that you're going to do the next few days are next week, just to mirror the fact that you learned something in the presentation and what I delivered to you. Thanks very much. Now we're going to go over to questions.
Okay.
Thank you very much, Patricia. So Sean, I'll just introduce Sean is up on screen now. Sean is thankfully we much appreciate. He's going to manage the question and answer session for the next few minutes. So if you want to just kick off, maybe Sean with the question.
Yeah. First, just say to Patricia and Frank, thanks very much for your presentations. There's some great information there that I'm sure we'll all take away and use in our day-to-day lives. So thanks very much for that, first of all. So we got a good few questions in on the Q&A, but also by email as well. So we'll go to Frank first. Just in terms of remote staff, do they need to be trained in manual handling? So these are remote workers who are fully remote or are never in an office or never on site.
Yeah, thanks. And thanks for that question. The situation with manual handling training, it's always first principles. It's not a case that the legislation says that everybody needs to get manual handling training. The requirement for manual handling training is informed by a risk assessment process that may decide or determine, based on the type of work people do at home. Primarily they may be working at a computer workstation, but if they're doing other kinds of work activity, that takes them away from that remote area, maybe traveling, one day a week or something, that needs to be considered. And really the risk assessment will inform whether or not that training is required.
Okay. Thanks for that, Frank. Patricia, kind of on a similar topic in terms of remote workers, what can we do to ensure remote workers have a good work-life balance and are taking proper breaks?
Okay, good question. And we have very good information on the whole piece of remote working on our website. So I'd advise all of you there to go and have a look at that separately to get a broader insight into remote working. But my piece is just the psychosocial piece on that. And I would say you have to make maybe more of an effort in the beginning because it's a different way of doing it. And because when you're in a workplace with the people, by definition, you're seeing people more and you can see who's in the canteen, or you can see the one person sitting there not taking the break, which you don't have the visibility on it when they're working remotely, and they don't have the visibility of the others. And we tend to follow what other people do. So you might find that when someone is working in the workplace, they're more likely to go in to the tea room or coffee room or take a walk when other people are doing it too. Or when someone pops over to them and says, do you want to go? So you have to make it a little bit more effort then when people are working from home, like either have an automated email that goes to them saying, hi folks, it's 11 o'clock. I'm hoping that all of you have either taken 5 or 6 minutes off or 10 minutes or whatever it is, or if not, can you please do it in the next half an hour? So you send little reminders. You also have to make more of an effort to keep in touch. And I would suggest that you do a structured way, like everybody knows that on Monday morning, there's going to be some structured approach by somebody. And every Friday, there's going to be some structured approach. Now, how you do this, the details of it aren't mandated, but best practice would be you send some information, you give regular reminders about breaks and about time and switching off again. That's important, morning and evening. Again, reminders on a Friday. Please, folks, don't be at your email after 4 o'clock or 5 o'clock. So you really have to use technology more when people are remote, and you have to reach out more, and you have to make more of kind of effortful behavior around it, because as I said, in the workplace, we follow each other and we'll do it because it's reinforced by the social environment at work, and it's not reinforced by the social environment of being on your own at home.
That's great. Thanks very much, Patricia. So, Frank, Patricia mentioned there about return to work. Manual handling is a training that people have to go through. This is a question that came in on the Q&A. In a case where an employee returns to work after a period of sick leave or following an injury, or more particular non-work related surgery, what is the guidance in terms of manual handling tasks and risk assessment for that individual who's returning to work after being out injured or sick?
Yeah, that's a very, very good question. This is something that comes up quite a lot when we're out on workplace inspections. The advice I typically give is that if someone's coming back to work and they have had some injury, in some cases it may not be work related, but that needs to be considered and flagged as part of a risk assessment model. And if that person typically would be involved in doing some sort of manual handling work activity, then the requirement would be to look at doing a risk assessment of that specific task. And as I was saying earlier, that risk assessment needs to ensure that all variables are considered. and taken into account, so that you get, I suppose, a proper risk assessment result in terms of whether or not there is a risk exposure. And if there are potential risk exposures for that individual, then they need to be managed and addressed. So that's the model I would use for that.
Thanks, Frank. And Patricia, then we have another question about kind of a psychosocial more return to work. What can we do as employers to help an employee who is dealing with a bereavement to return to work and be productive?
Good question again. I mean, again, there isn't really one answer for this, I suppose, but you have to look at, in the legislation, I suppose it's more specific that if the work caused the issue, then there's an onus on the employer. Now, in this case, the work didn't cause the issue, but still best practice, and certainly as a work organizational psychologist, best practice is to give some assistance to the person returning after bereavement. The person might be more prone to break down crying. They might be more prone to, without colleagues knowing. Colleagues can often speak about things, whether they're in the news or whether they happen to them, about another bereavement. And unfortunately, the bereaved person is hypersensitive to any discussion of loss or bereavement. And also they might be hypersensitive to any criticism. So they're vulnerable employees by coming back to work after bereavement. So I would say it would be a good idea to actually have a very short, and we don't want to be over policyed here, but a very short policy on, if someone's returning, the manager really should be cognizant of, I'm going to go a little bit easier on, I'm not going to not mention it, and I'm going to say, what can we do for you for the first week? And I'll meet again with you the next week, and maybe do it for a week first, then for 2 weeks, and then for 3 weeks, and then hopefully the person is back in. But I would be saying that, you really should take cognizance. It's not something that I think should just be ignored.
Great, thanks, Patricia. So we have time for a couple more. So Frank, this one is about standing desks. So when you're using a standing desk, should you use a footrest to rest one foot on to relieve the pressure from your back?
Yeah, I mean, typically what you may have normally we would kind of people would have, say, what we would call a sit-stand workstation. So that gives the option of ideally dynamic posture. So you're sitting and you're standing, you're varying your posture. So that would that would be, particularly that would be useful for people who may have an inherent issue with their back. However, it is important to point out that currently our legislation related to computer workstations, the display screen equipment regulations, it doesn't set out that it's a legal requirement to provide sit-stand workstations. Each situation needs to be treated on its merit, but primarily in the legislation it talks about providing a seat, a seat which has a backrest adjustability and overall adjustability. But again, if someone has that, this is where the supervision and consultation is important. That if people should be encouraged to raise a concern if they have a concern or to find a difficulty with the standing seat, then maybe some intervention should take place. Provide maybe a more appropriate footrest, or maybe look at other types of seating. But again, it's not a one size fits all. That everybody is given a sit-stand workstation. That typically would happen is, certainly we advocate that you could use them. You might have certain hot desk workstations that may use them, but it's not a situation where everybody has to have them, so just take it from that perspective and make sure that there's consultation and supervision to so that you're confident that you're taking account of people's concerns, or even if they have some symptoms of an injury that's managed.
Great.
Thank you.
Thanks, Frank. So we have time for just one more question. Any questions that we didn't get to, we will respond to by email over the coming days as well. So Patricia, this one's for you. There's a couple of people asking about using a stretch exercise program and if that's beneficial to the psychosocial aspect in the workplace.
No, it wouldn't be under our psychosocial hazard. I mean, it's a health promotion activity. Those physical health promotion activities can very much help a person to relax if they're feeling stressed. And I'm not saying they're not efficacious in their own way, but what we're looking at is work systems. So the work system that would be tweaked in terms of how the work is done, how the work is organized. We very much appreciate and promote health promotion and are aligned with health promotion activities. And there can be a variety of things, be either stretch or yoga or other kind of mindfulness, but they themselves are not part of the system of work. And we look really at the kind of assessment of the actual core systems of work and how they can be influenced or tweaked or made easier or made more palatable. And that's the approach that psychosocial hazard identification and risk assessment will take.
That's good. Thanks very much. That's it for the Q&A anyway, so thanks very much for that.
Thank you very much, Sean. Appreciate that.
Just before we wrap up, there is one other question I see in there, Sean. It's just what training is available to carry out specialist ergonomic risk assessments. Certainly, there are training programs available, externally. However, we don't have a recommended list, so you'd have to really do your homework there and look. But there are different organisations that do offer specific risk assessment training on, for example, the tools that are developed by the HSE UK. So that's just from that perspective. Just to say thank you very much, first of all, to you all for attending this event today. We really appreciate it, myself and Patricia, to see so many of you here, to see such interaction. It does the heart good to see it. The other thing I'd like to do is also thank our colleagues, because myself and Patricia really need to depend on the technical expertise of Gavin Keating, also Sean Walsh and Aoife, who is not here today, but they all gave great support to us in delivering this webinar today, and we hope you got something from it. As I said, the presentations will be made available pretty much at the same time the recording goes up on our website. And also, finally, just to say, we would really appreciate if you would fill in the survey and give us as much information as possible for feedback, because we do value that. So without further ado, I'll just say thank you very much to everybody and have a good day today. Take care of yourselves. Bye-bye.